Hello, my name is Dr. Wright, and I'm from the Wright Center for Women's Health. And today I would like to talk to you about female sexual dysfunction. I am going to first talk about the normal phases of sexual intercourse. The first phase is desire, and that's when you want to have sex. And then we have arousal. That's when all the blood flows to the genitalia and you have lubrication. And then we have climax. Climax is orgasm, and then the resolution. That's that kind of nice, warm, fuzzy feeling you get after the actual act. When we discuss female sexual dysfunction, in order to understand that, you need to understand those normal phases. And what that is difficulty with any of those phases. So for desire, you can have a low libido or a lack of desire. As far as arousal, there can be issues with getting lubricated or feeling that intensity working up to orgasm. And with orgasm, up to 43% of women actually have a difficulty with having orgasms, and up to 80% of women have difficulty of having orgasms with vaginal intercourse. And some women are actually anorgasmic, meaning they've never had an orgasm at all. And you can also have painful intercourse, which is called dyspareunia, and some women have that. So all of these things are encompassed in female sexual dysfunction. So what has been tried for female sexual dysfunction? There have been so many different things that doctors will tell patients: get better sleep, exercise, eat better, eat more healthy foods. I myself would tell patients to do timed intercourse or masturbation. There's actually medications out there that some physicians have tried, medications that were actually for men, and they tried them for women. There's medications that have a mind-altering component, but all of these things are not exactly for the female sexual dysfunction, and these are things that have been tried, and they might help a little bit, but not great. And some women are actually embarrassed to even bring up the situation to their doctor, and the doctors really a lot of times don't like to talk about it because they only have so many things in their armamentarium. And these are things that have been tried, and it's time for us to come up with something new, something different to more directly help with this problem. So there is something new out there for female sexual dysfunction. It is called the O-shot. The O-shot is injecting something called PRP into specific areas of the genitalia to help rejuvenate the area. PRP stands for platelet-rich plasma. What we do is we draw your blood, we spin it down in a FDA-approved machine called a centrifuge. And that makes the red blood cells go to the bottom, and this yellowish, wonderful serum called platelet-rich plasma goes to the top. This platelet-rich plasma is drawn off and injected into the anterior vaginal wall and into the clitoris. And as I say, that does sound like it could potentially be painful, but it's actually a very painless procedure. And when you do this, it actually brings growth factors and fibroblasts and fibrin and platelets and something called neovascularization to the area to make it healthier, stronger, more robust, and really rejuvenate that area to give better orgasms and lubrication, increased libido. It actually even makes the introitus to the vagina tighter. So the O-shot is platelet-rich plasma into the anterior vaginal wall of the vagina as well as the clitoris to help rejuvenate the area and improve the sexual function. What is possible because of the O-shot is all the things that I discussed before with increasing libido, helping with arousal, increasing lubrication, also enhancing orgasm or making orgasm a little less difficult to achieve. It also can help with dyspareunia, and with women who used to have painful intercourse, it now helps them to no longer have that painful intercourse. It also helps with urinary incontinence and something called lichen sclerosis. It helps with overall sense of well-being. It helps with relationships. Husbands are happier, partners are happier. It makes for better partnerships, healthier families, and this helps with the overall sense of well-being. I have been doing the O-shot for a little over a year, and I actually had the O-shot done myself, and it works. And patients are happier, and I love helping patients, and this is what the O-shot does. The O-shot helps with that female sexual dysfunction. The O-shot might be for you. Just call our office, make an appointment, and see if the O-shot is for you. Thank you.